Hello friends, myself Dr. Avir, and in this video we will be demonstrating about per speculum examination. This is of course in a mannequin, and we will also be discussing about the Sims speculum and the Cusco speculum. Now at the very onset I would like to describe this is the Sims metallic double bladed hollow posterior vaginal wall speculum. This is used for a per speculum examination whereby the posterior vaginal wall is retracted with the same speculum. With this speculum, you have to use the anterior vaginal wall retractor. This is a metallic retractor which is used for retracting the anterior vaginal wall. At the same time, I would like to also tell you about this speculum, which is the Cusco speculum. This Cusco speculum is self-retaining, and so is the advantage. That is, a single operator can use this Cusco speculum, whereas in Sims, you need an assistant who will assist you with the speculum. So let us see in this mannequin, what we do is at the very onset, you have to take consent from the patient, verbal consent, and patient will evacuate her bladder and then lie down in dorsal position. Then for a vaginal examination, we'll just paint the area if betadine is available, and then we will insert the same speculum. So for insertion of the same speculum, it is inserted in this manner and then rotated so that the posterior vaginal wall is retracted. Now with this, we will also use the anterior vaginal wall retractor. As you can see, with this, I'm retracting the anterior vaginal wall. So you can see the cervix which is visible. Now what are the uses of this Sim speculum? It can be used for gynae examinations, like if you are taking a pap smear or liquid based cytology, you can use it, or any interventions can be done like cervical intraepithelial neoplasia. When you are doing a LEAP or LLETZ, then these things can be done, or any intervention which is done. Apart from that, in various gynae surgeries like VVF repair or other surgeries prior to per speculum examination, we use this same speculum. Also, it has some obstetric uses like for cervical encerclage operations, that is McDonald stitch. When we take, we need a large area, so for that Sim speculum is required. Now coming to Cuscos, we insert the Cuscos in the similar manner and we open the blades by retracting it, and at the same time we can fix it so that it is self-retaining. So it will be placed in this manner, and then we can inspect the cervix. So after the cervix is visible, we can perform certain procedures which require minimal intervention, like taking a pap smear from the cervix or inspection of the cervix, or doing certain procedures like or removing a copper T or taking a punch biopsy from an unhealthy cervix. So these procedures can be conducted. Just the advantage is that only a single operator can operate it because it is a self-retaining speculum.